Hello and more hello. So, I have a big topic for today. We got to talk about Medicaid. What it is, why it exists, and why the current GOP plans to change Medicaid are going to be a disaster. Uh, I'm going to start by saying that you may consider me a little bit biased because I am actually on Medicaid. I don't make enough money to actually pay for my own health insurance. I mean, I don't even pay enough money. Well, I don't make enough money to pay taxes at the moment. I'm literally under the cutoff for the minimum amount that they'll tax. So, for that very obvious reason, I cannot afford health insurance. Uh, so, Medicaid is literally how I get my own health coverage. So, I'm going to be a little bit biased, but you all should be a little bit biased as well. Even if you make $1 million a year, you should be biased in favor of Medicaid. So, I actually want to start off with AOC explaining this a little bit, and then we're going to take a little look at some MSNBC reporting with Bernie Sanders. And I'm not doing the AOC one directly. We're going to take a look at the majority reports talking about AOC and her statements, because I want you to see that my opinion is not like just my take. There are lots of people out there who are going to have a lot to say on this. So let's get into it.
The House Energy Committee on Medicaid. Once you're kicked off Medicaid, is this according to AOC? Well, listen to this. I didn't realize this part of the bill.
And the math is not adding up. They're trying to convince people that they are cutting millions of undocumented people from payroll, from Medicare, acting as though this is what's going to save it. Even if you believe everything that Republicans have said today, they are identifying 1 million, their claim, which I dispute, but if you believe them, their claim is that 1 million undocumented people are on Medicaid. So why are they trying to cut 13.7 million Americans off their health care? By the Republicans' own Energy and Commerce tweet this morning, their claim is 7.6 million people are somehow ineligible for health care. So why are they cutting 13.7 million Americans off their health care? They've asked us to read this bill, and we have. This bill bans the people that they kick off of Medicaid from even buying their own insurance from the Affordable Care Act exchange. So once you are kicked off Medicaid, you then can't even buy your own health insurance.
Pause it. I just want to be clear on this now. So the Affordable Care Act in the states that it's operating in has different tiers in which you're eligible for certain subsidies, whether you're above 133% of the poverty line, 200, 400%, whatnot. And essentially what I guess this bill does is it boots you off, pretends that you're undocumented, essentially, and you are not eligible for subsidies. You probably can go buy it, but at a cost that's completely prohibitive. Go ahead.
So once you are kicked off Medicaid, you then can't even buy your own health insurance. It increases costs for people who they deem eligible and who are low income and forces them to pay even more. And if you have a private insurer, don't worry, you're getting screwed over too, because your healthcare premiums are going to skyrocket from the disaster that is happening from this bill.
And just to be clear on that last part, people who lose Medicaid still get sick. They still can get hit by a bus. They still can get cancer. They will not go to the doctor to treat some minor thing until it turns into a major thing because of the cost. And then they'll go to the emergency room, and then we will all pay for it. So even if you feel that people who are poor are not morally righteous enough to deserve health care, even if for your own self-interest, understand that it's going to jack up costs for everybody.
Penny wise and pound.
I'm gonna cut them off there for the moment. So, they actually did release the full text of their budget proposal. It's like 400 pages long. And yes. I've seen this myself because I tried to get my own insurance through the state portal for the ADA provided healthcare plans. If you make under a certain amount, you have to pay not like a subsidized amount, but instead you have to pay like the full amount for a plan. Basically, if you make too little, all your costs balloon. Like, I was looking at plans that would be like $50 a month if I made like $30K a year. But since I was under like $12K a year, they would charge me $500 a month. If you can do some math, if you make under $12,000 a year, that's $1,000 a month. So they wanted half of everything you make at that $12,000 cutoff to just have basic health care. And that's literally no thrills, no frills, no nothing. It just covers like going to see a doctor and like basic prescriptions. So very cost prohibitive. And if you're in that situation, you're making that little, they do that because Medicaid, to their minds, is supposed to be there to cover you instead. I was literally told by one company, go get on Medicaid. Because basically, you shouldn't be coming to us. But I had a heck of a time actually getting on Medicaid. There's a lot that goes into that, but it wasn't an easy process. Even though I made almost nothing, and I still make almost nothing, I'm still not at that $12,000 a year. So yeah, I am still in part of that. Also, not talked about here, but we're gonna get into it probably in something they mention in the MSNBC coverage with Bernie, that they want to kick out any males that are on Medicaid. And we know this government is very binary in their thinking. As a trans woman, they probably consider me a guy. So, for that reason, they might want to kick me off anyways. I'm apparently not female enough for them. But thankfully, this is not a done deal yet. Thankfully. I mean, they're trying really hard to make it that way, but let me switch over to Bernie. AOC had more to say. This little clip does not cover that, but let's switch to Bernie. All right.
Joining me now, someone who spent decades on the front line of the fight to preserve Medicaid, along with other government programs, Senator Bernie Sanders, independent of Vermont. Let's start with the characterization there. I thought that was succinct. He calls them cuts. I call them savings. The line that they're giving about these big cuts to Medicaid is that there are work requirements, that there's too many able-bodied people laying around getting free health care. We believe welfare dependency, not work, is the barrier. That's an op-ed from Robert F. Kennedy Jr., Mehmet Oz. What do you say to that?
Before Bernie even gets into it, I want to just briefly touch on the whole concept that Medicaid only goes to people on welfare. Obviously, I am technically not on welfare. My state does not offer it to me. I get some, well, I guess you could say some types of welfare, but it's basically just health insurance. And the other program they want to cut, which is SNAP. Supplemental Nutrition something program. Assistance, yes. I forgot what the A was. But I get like $100 a month in SNAP that I can only use to buy food. I don't know if you've been to a grocery store anytime soon, but that is not much. But I'm getting a little bit distracted. I'm not on any other sorts of welfare programs. I don't get like monetary assistance. All they do is provide a little bit of food and healthcare for me, and that's literally it. They're trying to say that it's people who should be going out and getting jobs that they want to take this coverage away from. There's a little catch to that, though. A lot of people getting Medicaid are people who have working jobs. They work at places like Walmart's, McDonald's, other fast food chains, other retail outlets like Walmart. I mean, Walmart's business model is based on paying so little to their employees because they know programs like Medicaid are going to be there to provide health insurance rather than them. That's how their business model is structured. It's a bit of a different topic slightly, but I can go pull up a video if anyone in the comments wants that will talk about that. I just saw one earlier today, and I can go bring that up and make like a addendum video to this one for that. Oh, and the capture card fixed itself. Good. But a lot of these big companies, Amazon is in there too, they make their money off of not paying things like health insurance to their employees because they know Medicaid is there. If Medicaid is not there, there are going to be so many working Americans who end up not having health coverage. And it's going to be the poorest Americans who are that part. In fact, the video I saw earlier, each and every Walmart employee gets an average of $5,000 a month in, no, $5,000 a year, sorry, in public assistance. That's across the entire U.S. So, that's $5,000 Walmart, and specifically the Walton family didn't have to pay their employees. If they really wanted to do something that helps, they would actually change it so that companies like Walmart can't just rely on making people get on state programs while they're employed by them. They would say that there have to be minimums there that any working person has to be able to do. But they don't do that. They just say, yeah, go work. You'll get health insurance somehow. I don't know how. I don't care how, but go do that. All right, let's get into the video. Bernie, what do you got to say?
It's nonsense. The overwhelming, we're going to be looking at $715 billion in cuts to Medicaid and to the Affordable Care Act. That means, Chris, that according to the CBO, over 13 million Americans are going to lose their health insurance. And then on top of that, what the Republicans are proposing is a $35 copayment for many Medicaid recipients.
Right.
If you are making $16,000 a year, you know what? You can't afford that $35. You are not going to go to the doctor.
Yeah.
One of the outrageous dysfunctionalities of our current healthcare system is we lose some 70,000 people a year die because they don't get to a doctor on time. When you throw 13 million people off of health insurance, when you raise co-payments for poor people, it is a death sentence. Thousands and thousands of low-income and working people will die because they simply will not be able to get into a doctor's office when they need it.
I'm going to pause this here for a sec because I'm going to add to this a little bit. I've been saying this on Blue Sky, so if you don't follow me on Blue Sky, you might want to. But I've been saying this for a while. But the people doing this, and right now that is entirely people that are part of the GOP. And I wish it wasn't just one party, but they do seem to all be very concentrated at the moment. But they really are trying to kill people. Because to them, those people aren't real people. They are effectively just being accountants, seeing people as numbers. And because they're not real to them, they can just cross a line item out. Doesn't matter to them. That can be 13 million people. They don't care. In fact, I don't know if Bernie's going to get into this, but I know AOC, in part of her speech that was not in that video, she talks about how these cuts don't just affect the people, but they affect the entire hospital system. If Bernie doesn't talk about it, I will at the end. So let's get back to Bernie.
One of the interesting dynamics to me, having covered government health care and these fights for a while, is the kind of recipe Republicans tend to use in these budget fights goes the following. Look, they're taxing you to pay for something for these other people, right? Yeah. And we're going to cut your taxes, and these freeloaders aren't going to be able to take it.
Except that example person that makes $16,000 a year, they pay taxes. Yeah. The cutoff for not having to pay taxes is not $16K. I believe last time I looked, it's like $12K. So, there are plenty of working people that are not only on Medicaid, but pay taxes.
Advantage the system. Right. It's interesting to me how Medicaid has moved from a thing that they could make that argument about easily back when I first started covering politics to something that feels politically a lot more like Medicare. It's something that's people understand how used and necessary it is. Does it feel that way to you, that it has more political power?
I think that's a very, very valid point, and I think that has a lot to do with a couple of factors. Number one, the healthcare crisis is absolutely acute. You have millions and millions of people who even have health insurance, can't find a doctor, can't afford their deductibles to pay when their deductible is high. So you have a crisis right now in Medicaid, which covers some 70 million people, is a lifesaver for those people. Number two, Medicaid provides about 60% of the funding for nursing homes. So you have a mom or a dad in a nursing home where you need to put them in a nursing home, that's Medicaid.
I'm also going to add here that since 60 to 70% of the people on in nursing homes are on Medicaid, most likely those places won't be able to operate if they're not getting funding. So, if your parents are in a nursing home and they're on Medicaid, there's a good chance that nursing home will go out of business. And I guess you get to take care of your usually at that point, critically disabled parents or grandparents. And that's what they want to do.
And thirdly, Medicaid provides substantial amounts of money for community health centers. 30 million people go to community health centers. You need that primary health care. Medicaid is there.
I'm going to cut him off again because I need to expand on this point. In rural areas, and I live in a rural area, so this is directly related to me. The closest city to me, which is barely a city, it has I think 8,000 people. It's hard to say for sure, but I believe it's 8,000 currently. They're the closest hospital to me, but they're a community hospital. If they didn't take Medicaid money, they wouldn't keep the doors open. My city, my town, I don't live in a city. It's too small. Though, we're at 5,000 people, so we're decently sized compared to the city next to us. But we have a clinic here, and that clinic is a community clinic. Most of their funding comes from Medicaid. With these cuts, there's a good chance those will just go away. Luckily, there is a larger city in my area that has not one, but 3 hospitals. And it's unlikely that all those 3 hospitals would go out of business, but that's 40 minutes, 45 minutes away. So if you need emergency care, well, I guess you're just screwed. Yep. Law of unintended consequences. There are entire states, specifically, I should mention red states, where up to 90% of their hospital system is built on Medicaid. So when Medicaid funding like this goes away, their entire hospital system might go away. There can be states that there might be a single hospital in the state capital that is the only one for the entire state. So just think on that for a little bit. And let's get back to Bernie.
So Medicaid is playing a role like Medicare in providing care to millions of people. The average American does not want to see it cut.
So you've got, Josh Hawley saying don't cut Medicaid, although it looks like they're gonna give themselves wiggle room, right? They're gonna define them as things that aren't cuts. And then I want to play you something. Ron Johnson, Republican colleague in Wisconsin, he's been saying this thing's doomed to fail. It's not going to get enough support in the Senate. I'm not quite sure what he's at. He seems to be thinking they're not cutting things enough. But I want to play this for you and get your read on how much this is a bluff and how much this is real. Here's what he had to say.
He only has so much time. But again, I don't want to undermine his strategy because unlike others who are hoping he fails, I hope he succeeds. I hope he succeeds spectacularly. I hope all my concerns are alleviated. But again, so that's why my primary focus is spending. But we can't.
So I'm going to cut him off for a second. His whole deal is that he's a politician focused on the deficit. And he believes there should be even more cuts to public services. His brain is a little backwards. The reason they're doing all these cuts is not to get rid of the deficit. It's to get tax cuts for people that are stupid wealthy. A little bit of that will trickle down to like median income people. But for the most of us, that's not us. It's going to raise taxes on poorer people. And that's if you're, even able to get things like healthcare and other programs to help out with that. So, if he really wanted to fix the deficit, he would go after people with the actual money to keep the government open. But he doesn't want to do that. No. He wants to take more money from public programs helping out the people who, by large, are the ones actually funding them. And he's happy, for the most part, to put that money back in the hands of the richest people in this country. So, yeah, you work for these people because they're the ones with all the money. They have you get on welfare programs because they pay you so badly. And then when they tax you, they want as much of that tax money to go to those same billionaires that don't pay you enough to survive in the first place. But that's not his issue. He just wants to balance the deficit, which is a fine idea. And we could do it easily if we just taxed large companies and large, in terms of numbers, billionaires and near trillionaires at this part. So I'm gonna skip forward a little bit. I don't really want to listen to him.
We're not doing that.
Johnson said basically, we're not cutting enough spending. I'm not going to vote for this. Right. I've got a bunch of other Republicans who won't. I tend to think that's talk is cheap, but what do you think about what's going on here?
I think you're right. At the end of the day, Trump's pressure on them and Musk's money on them, if they don't support it, they're going to get primaried, and Musk has unlimited amounts of money to spend against them. I think that will likely prevail. But the idea that at a time of massive income and wealth inequality in a bill which we're going to provide $660 billion in tax breaks for the top 1%. The idea that we're not cutting programs for working people and poor people is absolutely asinine.
You have been on this tour. You've been talking about this a lot with Congresswoman Alexandria Ocasio-Cortez and others, the Fight Oligarchy Tour. You've put out, crazy numbers of people. Over 10,000 in Denver and folks in...
No, 34,000 in Denver, as a matter of fact.
Sorry. Thanks for the correction. I was just pulling that from back there. 34,000 in Denver. Huge numbers of people. What is it? Have you been surprised by those numbers? And what does it say to you?
Well, look, remember, this is not some kind of presidential campaign.
No.
There is no election, not running for anything. People are coming out in huge numbers because they are deeply concerned and frightened about what's happening in this country, and they want to see Democrats stand up and fight back in a very aggressive way. So number one, they're worried about the growing authoritarianism of the Trump administration. They're worried about the kleptocracy of the Trump administration. And they're worried about what we just talked about, massive tax breaks for billionaires, while 60% of our people living paycheck to paycheck and ordinary Americans struggling just to put food on the table. So the American people look at all of this and they say, what the hell is going on? We want a government that represents not just the billionaire class and the oligarchs. We want a government that represents all of us. Let's do it.
All right. That is basically where the video ends. I have one more video because I said we were going to cover a little bit about Medicaid and what it does. And Adam Schiff here talks at least a little bit about it. And I'm going to cover the first parts. He did this about a month ago. So it predates what we're directly talking about today with the current budget proposal. But he does describe, at least in basic terms, what Medicaid actually covers. So let's see what he has to say.
So tonight I want to talk to you about Republican plans to cut Medicaid.
And
but first, let's talk
those
about
plans
Medicaid.
have been around for a while.
Now, if you get your health care through the Medicaid
We just didn't
program,
know what they look
you
like.
know the importance of that program all too well. But what if you don't
Also,
get your
yes.
health care through Medicaid? What exactly is Medicaid? You might be familiar, of course, with Medicare that provides health care for seniors. But what about Medicaid? Medicaid is actually the largest insurer, the largest health insurer in the country. In that sense, it's even bigger than Medicare.
And before he gets onto that, remember, a lot of the people on Medicaid are people who work for places like Walmart and McDonald's. So, places that aren't willing to offer like health insurance to their basic employees. That's one of the biggest reasons that people are on it, because they don't have either the money to pay for health insurance themselves, even with help from the government, or they don't get it from where they work. And unfortunately for us in the US, we did not get any form of health care for all. So we're left usually getting health care through our employer. But when that employer doesn't offer it, we're sort of screwed. All right, let's get back to it.
It covers 70 to 80 million Americans. It significantly
about
covers
72.
children. So about 4 in every 10 children get their health care
yes,
through
almost all
Medicaid.
children.
About 1 out of every 6 adults gets their health care through Medicaid. A lot of people who are disabled get their health care through
Yes.
Medicaid. If you're getting long-term care, you're a senior and you're getting care at your home, or you're in a skilled nursing facility, there's a significant chance that eventually, if not from the beginning, you will get your health care through Medicaid. And the reason is that Medicaid predominantly serves lower and middle income families. So even if you start off as a middle income or a high income family, and healthcare is expensive and you're a senior and you run out of resources and you deplete your resources, then you start getting your healthcare through Medicaid. Now, Medicaid goes by many names. In California, we call it Medi-Cal. It is funded in part by the states and it is funded in part by the federal government. Depending on the nature of how you get your Medicaid, it might be a 50% match, 50 state, 50 federal money, or it might be a 90% federal match, 10% state. But it is an extremely important.
Yeah, and just on those percentages, red states tend to get more of their funding from the federal government. So if you live in a Republican-led state, the chances that you're going to have more of your Medicare budget, Medicaid budget, sorry, coming from the federal government is higher. And by the way, the biggest rate is that 90%. So, like some red states, I can't tell you which ones without seeing the list because I don't want to be wrong about which one it is. But they get that 90% rate where most of the funding is not the state because the state literally cannot afford it. So the federal government and therefore the taxes from the entire country go primarily to help those states because those states have the least ability to actually contribute. My state, PA, is about half to half. So about half the funding is state, half the funding is federal. And I think California is one of the rare cases where it's not even 50-50. The state pays more than the federal government. But California is one of the states that basically carries the rest of the country. So, at least economically. In fact, I think they just recently passed Germany in size of the economy in California. So, anyways, let's get back to it.
Important source of health care for tens of millions of Americans. Now, let's say.
Oh, before he gets onto that, I brought this up a little bit ago. Well, I hinted at it a little bit ago. But about 40% of pregnant women have Medicaid step in to cover the costs of their pregnancy. So, 40% of women might not have the medical coverage required to be able to actually go through with their pregnancy at a conventional hospital. We could see a very sudden resurgence in like midwives because your neighbor who has had like 3 kids is gonna have to be the one to take care of you because you can't go to a hospital. And God forbid you have any issues with your pregnancy because I mean that neighbor is going to be your only resource medically. I mean, they're probably not really trained for that. People who actually have official training usually want, compensation. Because it's a time-consuming and stressful activity. And, who's going to do that for free? Not many people. So, yeah. It's going to cause a huge issue with specifically poor women, but to some degree, any woman. And also younger women. Because usually the most likely to be pregnant are both poor and young. We could be looking at deaths during birth that look more like a third world country if they get their way. So, anyways, let's go back.
You're not on Medicaid. Why should you care about what happens to Medicaid? Well, because we're all part of the same healthcare system. Whether you're getting private insurance or Medicare or Medicaid, you're probably going to the same hospital. And if suddenly a huge portion of Medicaid funding is taken out of that hospital may close its doors. Already, particularly in rural parts of America, hospitals are shutting down. They just can't make ends meet. The reimbursement rates under programs like Medicaid are already so poor, a lot of doctors are saying, I'm just not going to take Medicaid patients. So if we take all that money out of the Medicaid system, a lot of hospitals are going to close, which means whether you're in Medicaid or you're not, your hospital may just close down. The same is true of healthcare clinics. Whether you're in Medicaid or not, you may be going to the same health clinic. If that clinic shuts down, it means you have to drive farther for that care. So we all have a stake in this. Anyone who needs to get to a hospital.
A hospital? What is it?
It's a big building with patients, but that's not important right now.
That's right. We're all going to face a circumstance sooner or later
really hope
where we need to get to a
does not
hospital,
get
and
copyrighted.
Medicaid is a big part of the
It's in his
reason why
video,
those
so.
hospitals are available to all of us, particularly to those who are lower income, but to all of us. So what's the threat right now to Medicaid?
All right. We've already covered the threat. So, and it's a lot more specific than he's going to talk about. But he does actually a decent job, which is why I decided to use his video for that. But I hope that gives you an idea. So, have we explained why Medicaid is a thing? I think we have. It's to make sure that disabled people, pregnant women, basically anyone who can't afford regular health insurance can have some form of health insurance. And by the way, that still excludes like undocumented immigrants. They cannot qualify usually for Medicaid or any services usually. They do sometimes pay taxes, but that is about the only thing they can do. They usually don't get any benefits from our system. A little exception to that is for like pregnant women who can be undocumented and sometimes actually can be on Medicaid. And by the way, we do that only because their children will be citizens of the country. Well, at least until Trump nukes birth citizenship, which is a different topic. But yeah, it's for anyone basically in this country. And he's just giving you the numbers. 1 in 6 adults in this country can't afford health care. So they're on Medicaid. 1 in 6. Let that sink in deep. That's why it's the biggest health insurer in the nation. And if we were a sane country, we would tax corporations and the people with money to allow us to get rid of the current health insurance structure and go to a Medicaid for all system. Medicaid would just be like the insurer. You can even have a system where you can get additional coverage through like a private insurer, and that would be fine. But basic coverage through the state would solve so many issues. I'm always going to be on about that. If you don't believe in that concept, frankly, I don't want to talk to you because we are the only developed nation that can't have health care for everyone. If I go to like France and I get food poisoning, I don't have to worry about health coverage But if someone from France comes here, they have to worry about health insurance when they get food poisoning. I think that says a lot about us as a people. All right, well, I think we've talked long enough. So, with that, I hope you've enjoyed. Maybe you've learned something. If you have any commentary, please put that down below. If you have liked this, please like and subscribe if you're not. And I think that's it. So, have fun, take care, and see you later. Bye.